खाने वाले वो पसंद करेंगे।
देखिए
Just teamwork. It is human endeavor. It is not any ex-individual. If I start taking Vijay Mila hai, friends and colleagues like you all, you know, Rasta always is good. It's fun. You understand? We meet, we do a lot of things together. We laugh, we play, we eat. But we also work. We also are serious about what we are doing, about health promotion, about treatment, about palliative care, about community outreach. And all of this does not happen just like that. It happens because of human collaboration. And the journey is the reward. रास्ता ही हमारा reward है. What we experience when we work together, you know, as a team, as collaborators, as different people from different walks of life working for a common goal. There is a media person, there is a doctor, there is a social worker, there is a government official, there is an ASHA. Everybody from different spheres of life, they all are working for a common good. And then there are different specialists. So there is a lot of satisfaction in that. That हमारे कारण, as a collective group of people, हमारे कारण life is transforming for people on the ground. Very inspiring. Don't you think so? आपको नहीं लगता?
हाँ,
इतने साल हो गए, कभी भी किसी ने मेरे से नहीं पूछा यहाँ क्यों आए हो? You don't belong. कभी भी किसी ने बोला नहीं. आप 25 साल कैलिफोर्निया में रह जाओ, you're always an outsider. You're an Asian. You're an Indian. You're never an American. Whereas nobody, nowhere has anybody asked me, why are you here? आप यहाँ क्या कर रहे हो? आप यहाँ के नहीं हो? कभी नहीं पूछा यार. And why will they ask? I'm an Indian.
nobody will ask.
I can. That is the beauty of India. You know, we are like a continent. We have different places, different cultures, different languages, different food. But you are never an outsider. If you see job, you will दाल रोटी सब्जी सब जगह मिल जाएगा. You never, कभी भी आप कहीं पे भी जाओगे, you won't feel as if you didn't belong. उन्होंने मुझे इनवाइट किया और पहले मैंने बोल दिया मैं नहीं आऊँगा. ठीक है. वो लगातार बार-बार फोन करते हुए, बार-बार चिट्ठी भेजते थे, बार-बार सोसाइटी का कहानी बहुत इंस्पायरिंग है. People who didn't know anything about cancer, lot of them non-medical people, उन्होंने जुड़ के एक सोसाइटी बनाया, ऐसी कल्पना किया. उस कल्पना के कारण we are where we are. Without that seed, ये नहीं बनता. And that is a very inspiring wife. My wife used to work in the USED, the United States Education Foundation in India. And जब हम लोग आए, मैं तो हॉस्पिटल में टाइम बिताया. Society members showed her around the hospital, they took her around the community. We went looking at schools, and you won't believe, every school, the principal said, "Doctor, come, your daughter will get admission." And so she doesn't know Hindi, she doesn't know Bangla, she doesn't know. Don't worry, doctor, kids are very smart. And then I went to the local KV. The local KV principal, I am a KV product. The local KV principal, Hari, was also a KV product. He passed out, I passed out from KV Tambram, he passed out from KV Kapurthala. And in 5 minutes we had that common background. Ravi, your daughter will get admission. Lucky she had to write an examination. She didn't know what an exam was. She was in a school, she did not believe in examinations. Every year passed. So, but then so much of support, you know. And before we could go back, my wife, you know, I remember very vividly, we were in that, there's no longer that hotel on that road that goes opposite Vikanshul's
Bilpar.
There used to be a hotel called Indraprastha. So we were on the second floor. I was sitting on the windowsill. There was rain falling, and there was somebody on the bullock cart going down. And Sita and I had this conversation. Sita said, "Ravi, there is a lot of need here. This is what we should do." And my daughter was sitting there. She was thinking, "Amma, are we moving here? I will miss all my friends." And she started to cry. and we had to sort of console her. And then when we went back, she started discussing in both sets of homes with my parents, with her parents. All of them thought we got married. In 2007, I know because I gave a written plan of what we should be doing, and I saw what could be done. I did not have any idea of the challenges that we would face. I had nobody taught us health economics, nobody taught us behavior change, nobody taught us many things that are needed to run a hospital. I didn't know what hospital. If Kalyanda was not here, I don't know what would have happened to hospital administration. Okay. But so many things just happened on their own, serendipitously. All the coins fell into the right slot, you know. And so we were able to do, and then more people joined. Ritesh joined, Debu joined, Abhijit joined, follow me. So many people joined. I didn't invite them. They all Sarita came.
Ravi, Rajiv.
Rajiv came, yes. And they have stuck on with me. See, 10 years gone by, Rajiv joined 2010. Ritesh, follow me joined 2009. Debu joined 2008. They've all, Dr. Datta, they've all stuck on. We are now a long association of shared experience. Now, collectively, we are now thinking, how do we see the whole process is healthcare must be as close to the people as possible. And so, one of the reasons why cancer deferral rates amongst patients is high is because they have to travel more than 3-4 hours or 200 kilometers. A lot of money coming from Karimganj to here. If you reserve a vehicle, it's 3,000-4,000 rupees. Imagine coming every day, going back, it's not affordable. And so our now current thought is, it is all right, we have a hospital here, we do surgery, radiation, chemotherapy, but we are thinking we must have another hospital, maybe in Dharmanagar, maybe in Afghan, wherever, which will be not 150 beds, but 30 beds, where we will do chemotherapy, where we will do surgery, where we will do all these things, patients can be admitted. And for each of these hospitals, we will have satellite clinics, which will not admit patients. They will have 6 beds, maybe a staff of 6 or 8 or 10, where we will do all daycare work, follow-ups, investigations, palliative care, chemotherapy, no surgery, no radiation therapy. But a lot of activity can be covered in these satellite clinics. So we already started one in Barigram, we're looking at one in Haflong, we're looking at one in Jiribam on the road to Tamenglong. So we're looking at satellite clinic, and then there are communities. We went through the Jinam Valley, you know, there are communities, 3,000, 4,000 people, less than that, 60 families, and there's no facility there. And so we're looking at putting PEP centers, PEP, prevention, early detection, E, palliative care, P, which will be one man, one person center. And that man can do health promotion, can do palliative care, physical surgery, suture removal, drain removal, dressing, all lot of activity can happen. And so our thing is to go as close to the patient who needs care as possible. We want to promote health in a very big way. Cancer is tobacco, areca nut, alcohol, diet, exercise, infections. 5 things cause cancer. If you remove these 5 things, 60-70% of cancers will disappear. And so we can prevent cancer. We can not only detect cancer early, we can prevent cancer. But more importantly, tobacco, alcohol, diet, exercise causes heart attack, causes stroke, causes diabetes, causes hypertension, causes COPD, causes peripheral vascular. So when we prevent cancer, we are preventing a whole lot of other diseases. We can actually promote health in the community. And a healthy nation is everybody's responsibility. Your responsibility, my responsibility, everybody has this responsibility. If we are citizens of this country, producing for the country, protecting the country, promoting healthy lifestyle is everybody's responsibility. And I was talking to him earlier, I started talking to every media person who comes today that let us meet one of these days on a Sunday. I will sponsor lunch. But let us all, 10, 15 of us, 20 of us join together and say, 1 week in a month, we will bring out a note on cancer. Another week you will, another week you will. So, every newspaper will have 1 week dedicated to one day to something about health promotion, tobacco, exercise, diet, cancer, tuberculosis, diabetes, whatever, to promote health. And if all of us join together through the year after year, we will see educating the public is our responsibility. We have the privilege of knowledge, we have the privilege of words, we have the privilege of reach, and it is our responsibility to do this. And so if all of us join together, we reach the moon, Baba. You mean we cannot do this? Okay. So I'm pushing everybody, give me a date before you go out. When do we meet? I want a commitment on a date. ज़्यादा लोग इलाज के लिए आते, पहले लोग इलाज के लिए आते थे, गायब हो जाते थे. अभी हमने देखा ज़्यादातर लोग जो हॉस्पिटल में इलाज के लिए आते हैं, इलाज करवाते हैं. ये एक बहुत बड़ा परिवर्तन है. दूसरा, मैंने ब्रेस्ट कैंसर देखा. ब्रेस्ट कैंसर में मोर देन 95% यूज्ड टू बी एडवांस कैंसर, स्टेज 4 डिजीज. अभी ये कम होके अबाउट 15-20-25% of people come with earlier stage. I'm not saying early cancer. They don't come in stage 4 disease. So ये change हुआ. It has taken so many years for this change to happen, but this change is very perceptible in every site. So always change takes time. Overnight चुटकी करके नहीं होगा. But then it is happening. And if all of us, यही मैं बोल रहा हूँ, all of us join together, we can accelerate this. हमें बीमारी के बारे में, हेल्थ प्रमोशन के बारे में बात करना है. बट मेनी पीपल डोंट वांट टू गो एंड सी अ डॉक्टर बिकॉज वो सोचते हैं उनका सारा पैसा निकल जाएगा. बट देयर आर अपॉर्चुनिटीज फॉर सपोर्ट. गवर्नमेंट के साइड से there are national and state insurance policies available. There are several NGOs supporting early diagnosis, and so there is support available for cancer detection and treatment. But लोगों को मालूम नहीं है, इसलिए डरते हैं. So part of education is promoting health, talking about causes and prevention, but also about sources of support that are available for the common man. यही करना चाहिए.
What kind of
Related cancers, सबसे common cancers, head and neck cancer, food pipe के cancer, lung cancer, these are the commonest cancers in this area. And then gallbladder cancer. Quality of life की बात करते हैं. But quality of dying is also important. Nobody should die in pain and misery, and the family should not suffer watching the patients suffer. And so, while treatment and cure is important, reducing suffering is equally important. संभव हुआ because सबने मिलके काम किया. We looked at our data, we brainstormed ideas. हमारे हॉस्पिटल के लोग घर घर जाके पेशेंट को बुला के आते थे. आप इलाज के लिए नहीं आए, वापस आइए. हमने हॉस्पिटल में एम्प्लॉयमेंट शुरू किया. कम्युनिटी में लोगों ने, मैंने फ़ोन करके बोला, दादा आपके इलाके में कोई पेशेंट है, जाके बुला के. तो वो लोग गए. मीडिया में से सपोर्ट. सो I really believe it is human collaboration that brings about change in the hospital, outside the hospital. हर बार हम डीसी के ऑफिस जाके खड़ा हुए थे, कभी भी किसी डीसी ने मना नहीं किया. They've always been very supportive. So in big and small ways, in seen and unseen ways, this human collaboration is what brings about change. Hospital is a difficult job. Government chalana to, it is easy for us to criticize the government, but then whichever government it is, I'm not talking of any specific political party, but whichever government, their job is very difficult. It is easy for us to, but then the government cannot come and ask everybody, do you need support? We have to ask what is available. See, they have national insurance. We are affiliated to the PMJY, to the Adalab. When the state government started free chemotherapy drugs many years ago, we were one of the 5 hospitals empowered to distribute chemotherapy drugs free. So wherever the government can include us, the government includes. But what we specifically need, we only have to go and ask. Sometimes they will support, sometimes they cannot support. You cannot crib about times when they don't support and clap when they support. Everything is part of the game.
But they never say no.
Most times the district administrations have been very supportive. कभी भी किसी ने मना नहीं किया. See, pressure तो कभी भी नहीं था. See, हम बाध्य होके काम नहीं कर. We are not doing anything in compulsion. We are not doing anything under force. We are doing as a team. I speak for my entire set of colleagues. We are doing what we like to do, what we want to do. कोई हमको जबरदस्ती नहीं करना है, कोई डंडा लेके नहीं करना है. And हम जो करना चाहते हैं उसमें we are giving our best effort. Every time it is not successful, sometimes it is successful, sometimes it is not successful. But all that is fine. And these recognitions increase responsibility. It makes it necessary for us to make sure that we actually deserve this recognition. आप समझ रहे हैं? So that's about it. Success is essentially related to the stage of presentation. लोग अगर एडवांस डिजीज लेकर आएंगे सक्सेस विल बी क्योर. लोग अगर आरंभिक स्टेज में आएंगे यहाँ नहीं कहीं पे भी ये हालत यही है. So they will be cured. And as disease stage migrates to lower stages, the success will improve. Every year currently we are seeing about 5,000 new patients and about 25-30,000 patients on follow-up. ये बढ़ता है.
5,000 new and around 30,000 for follow-up.
So this follow-up will keep on increasing as more people survive. They will keep coming for follow-up. So that number will keep on increasing as our quality improves, as our outcomes improve.